Should I go live?
नहीं 2 मिनट के बाद फोन
अच्छा चलेगी ना?
यू आर लाइव नाउ
स्लो
नहीं वो दैट विल बी देयर क्वेश्चन है
Hi, Dr. Sumedha. Hi, I'm Arshia, a dietitian here at Assurance by NanoHealth. How are you doing? Am I audible? No. Dr. Sumedha, you're not audible. Dr. Sumedha, I cannot hear you. Yeah, now I am. Now I think you're audible. Yes, I can hear you now.
Can you hear me now?
Yes, Dr. Sumedha.
Do you have the script?
But it's not very clear.
The other room?
I cannot even see your video, Dr. Sumedha.
My camera is not coming from here.
Okay.
I will log in from my phone. So if I to see from phone to see this, then I will join the room again. Okay.
क्वेश्चन
Hello.
Yes, hi, Dr. Sumedha.
Okay.
Yeah, so you're audible, you're visible, everything is perfect now. Yeah, so I'm admitting people.
हार्ड में रहती लेक्चर बैठ के
Hello, Arshia.
Yes, Dr. Sumedha.
I'm okay. I think I'm audible now and my video is also there.
Yes,
Is
yes,
it fine?
yes, perfect.
Mm.
Yeah.
Sure. So shall we start in another 1 minute?
Yes,
1 to 2 minutes?
yes. People are, I
Done.
think, they're getting on the session. Let's wait for another 1 minute and we can start off. Can we start?
Okay, let's start. Asha.
Yes, yeah. So hello everybody. Hello all the health enthusiasts. Welcome to another enlightening episode of Assurance Talks. I'm Arshia, dietitian at Assurance by NanoHealth and your host for today's session. So today we are not just exploring the intricate world of thyroid wellness, we are confronting a stark reality. The recent data from NanoHealth encompassing over 10,000 corporate employees in 2023 alone reveals an alarming statistic. That is, nearly 10% of employees are grappling with thyroid issues. Now, why is this more than just a number? Because it directly translates into a significant impact on productivity. Now, joining the dots between health and productivity will shed light on why it's critical to understand the symptoms, accurate diagnosis, and effective treatment, and how this can be transformative, not just for the individual well being, but for the health and resilience of your entire company. So, today we have Dr. Sumedha Verma, and get ready for an enlightening session on thyroid wellness as Dr. Sumedha takes the stage. And Dr. Sumedha has done her MBBS, DGO, and she's a diabetologist, currently working at AED Hospital at Kukatpalli, Hyderabad. Dr. Sumedha is more than a healer. She's a wellness advocate. As a valued partner associated by Assurance by NanoHealth, she plays a pivotal role in realizing our vision of preventing hospitalization. With a wealth of experience in diagnosing and effectively treating thyroid patients, she stands as a beacon of knowledge and expertise. Join us for an insightful exploration into thyroid diagnosis, lifestyle, and treatment options. Dr. Sumedha is here to empower us with the knowledge we need for healthier tomorrow. Dr. Sumedha, over to you.
Hello, good morning, everyone. So today I'm happy to address a very important hormonal issue, which generally in Indian population is known as thyroid disorder, which is thyroid, hypothyroid and hyperthyroid. Both are very important. So I would like to know what is the importance of thyroid from you, Ashia. Can you tell me what are the importance of thyroid?
Yes. So, in the symphony of our body's functions, the thyroid emerges as a maestro orchestrating myriad of, various physiological responses, and it is crucial for our well-being, overall well-being. And it is situated in the neck, and it is a butterfly-shaped gland, and has, it plays an important role. Its core, it helps in secreting hormones like thyroxine, T4 or T3 that acts as metabolic conductors, and it helps in fine-tuning energy utilization, growth, and overall cellular activity. And it is the conductor of a grand orchestra.
Introduction to the thyroid gland. I will take over next.
Yes.
So imagine the thyroid as the conductor of a grand orchestra, each hormone a note in the symphony of life. Through the communication with the pituitary gland, the thyroid ensures a harmonious balance in the body's energy expenditure. When this delicate equilibrium is disrupted, The consequences reverberate across various bodily systems, leading to conditions like hypothyroid or hyperthyroid. Can you hear me?
Yes, Dr. Sumedha.
So beyond metabolism, the thyroid extends its influence to cardiovascular health, mood regulation, and even body temperature. It is the unseen force behind the scenes, steering our bodies through the ebbs and flows of daily life. Understanding the thyroid's pivotal role, it becomes paramount for let's unravel the complexities of this gland, getting to indispensability in the grand narrative of our well-being. So, any question related to thyroid you have, Arshia?
Yes, Dr. Sumedha, I have a few commonly asked questions. So to start with, we would like to know the common symptoms of thyroid disorders.
Yeah, here's a simple breakdown of common symptoms for thyroid disorder. Like underactive thyroid, in that we will find fatigue, feeling tired despite enough rest, weight gain, which is also unexplained, increase even with a controlled diet. There will be cold sensitivity, feeling excessively cold, dry skin and hairs. Sometimes we'll see that skin and hairs both are dry and even brittle. Hair fall is very common. Muscle aches and weaknesses also, sometimes they are so extreme in myxedema format that we have to check other muscle weakness parameters like CPK, creatine phosphokinase. So that occurs in underactive thyroid. The overactive thyroid has symptoms like weight loss. They'll be dropping pounds of weight without even trying. Nervousness, irritability. There will be rapid heartbeat on ECG if we see. There'll be heat sensitivity, more towards hot, warm weather. Trembling hands. Sometimes there are tremors, fine tremors seen, and we test through different various paper tests and other tests. Then there are thyroid nodules, in which a person or patient will typically tell about pain in the neck. Noticeable lump or swelling is also noticed. Voice changes, mostly hoarse. Hoarse voice will be there. Difficulty in swallowing also. Feeling like there's a lump and it's stuck. So we call it as odinophagia. Then there is thyroiditis. In that, there will be neck pain plus fatigue, also fluctuating symptoms. Symptoms may vary over time. So these are symptoms for the nodule. Remember, these symptoms may vary and not everyone will experience the same. If you notice these signs persisting, then it's important and essential to consult a healthcare professional for a thorough evaluation.
Great. So I can see from what you have said, there is a stark difference between hypothyroidism and hyperthyroidism. So one should not get confused with these two symptoms.
Correct.
So, Dr. Sumedha, can you also please tell us how we can do an accurate diagnosis of this condition?
Correct. So here's again how we can pinpoint different thyroid disorders. If we first see the history of a patient, we check about how the parameters are changing in a patient, the symptoms the patient is experiencing, such as tiredness and weight changes. Then after history, we see the blood test. In case TFT, like thyroid function test, T3 and T4, TSH, we have to check in both underactive and overactive one. And if there is low TSH, it is indicative of overactive thyroid. And if it is high TSH, it is indicative of underactive thyroid. Then next diagnosis can be thyroid imaging. Most of the time we are doing ultrasound over the centers to see the detailed picture of your thyroid, how the structure is, any abnormality, any lump or irregularity is there. Then biopsy is done for nodules. So if there is a suspicious nodule, we have to take a biopsy. We call it as FNAC, taking tiny sample from the lump to rule out any cancer also. And checking of antibodies. Sometimes antibodies, because of Hashimoto thyroiditis, is main cause for both hypothyroid and hyperthyroid. So anti-TPO antibodies remains a mainstay to check whether it is autoimmune. 99% Hashimoto is the cause. And then genetic causes are also there. We can check genetic causes for them. We have to explore further. It's an option if there's a family history in thyroid problems. So by combining these methods, these doctors generally get a clear picture of your thyroid health, guiding them to right treatment plan. And missing one thing, symptoms in the symptoms I missed in females especially, they'll menstrual irregularities. So that also comes in picture most of the time, leading to infertility in marriage. So, yeah.
Okay. Also, can you share some thyroid-friendly lifestyle strategies, which we can implement in our day-to-day life?
Mm-hmm. Yeah, we can actually maintain a thyroid-friendly lifestyle, which plays an important role managing thyroid disorders and supporting overall health. Here are essential strategies that individuals with thyroid concerns can incorporate into their daily lives. First is balanced diet. Well-rounded diet is paramount for thyroid health, including the iodine-rich foods. What are these? These are seafoods, and dairy. Selenium and is also found, which is found in nuts, are important and essential ingredients. Sometimes we miss on those. And variety of fruits and vegetables and lean meat, lean red protein diet, and whole grains. They are also good ones. Next is regular exercise. If we are having a good exercise regimen, it will regulate our thermoregulation and other metabolism, and essentially a part of thyroid issues, which like brisk walking, jogging, and yoga. If a person is engaging in all these healthy habits, it will also substantiate a lot. Stress management. Chronic stress can affect thyroid function, no doubt. Sometimes reducing some stress practices such as meditation, deep breathing exercises, mindfulness, that will also promote and support thyroid health. Plus sufficient sleep. Yeah, sleep is one of the factor. I have seen many patients overall when they are having night shifts, mostly the young generation, and morning they can't sleep because of the hours, the sun is there, and so that random disturbed sleep pattern also can substantiate to hormonal imbalance and thyroid also. Then processed foods, like we have to limit those processed foods, canned, tinned foods, the unhealthy fats, which also contribute to the hormonal and inflammatory imbalances. Overall, these practices will help in overall hormone health. So, if I'm not missing anything, just remind me in hormones. Yeah, mostly these are the factors which contribute, general practices which contribute to your health.
Okay.
And sometimes we are regular monitoring. We tell them to monitor their thyroid hormone levels every 6 weeks, firstly. And after the treatment, they can comply as per the doctor's orders. That will promote the stability of the hormones. And hydration is important. Some of them also stay hydrated. That will support metabolism. And sometimes there are goitrogenic foods which we have to avoid. Those are cabbage, cauliflower, broccoli. As a nutritionist, you might be telling all the food habits to avoid, which generally affect thyroid. So cooking these foods can help reduce the goitrogenic effects. Also, medication adherence. If they are off medicine for a while, again, the balance may change. So we have to see that they comply to the thyroid medications regularly they are taking. Consistent medication is a must to maintain the stable hormones. And also with collaborating with the health professionals and checking with them, with nutritionists, with endocrinologists, will help them to have a personalized plan, and that will also address specific needs and concerns. So by adopting these lifestyle changes, strategies, individuals can actively contribute to supporting their thyroid hormone balance, and it is crucial to consult a doctor and nutritionist to tailor these strategies to individualize the health needs.
Great. Can you also help us to understand how regular should we be in checking with the doctor with the prescribed medication? Is it once a month, regularly every month, or once in 3 months?
Yeah, generally it's 6 weeks initially, and then later it comes to be around 3 months' time because every hormone has some limited lifespan.
Yeah.
So check goes every 6 weeks is what we generally ask them. And what treatment options we have, and according to the complaint of a patient, they can come early also. But 6 weeks, 3 months is an option most of the time.
All right. So, what are the treatment options if we can get into the treatment options?
Yeah, in the realm of disorder management, clinicians employ some of the spectrum of therapeutic modalities tailored to address the conditions, especially patient-specific requirements. So here's some exploration to the diverse treatment. I will tell one by one. First is medication. Suppose in medication, first is hormone replacement. Definitely, if there is hypothyroid, we have to replace with the thyroxine, levothyroxine. It's a cornerstone for any treatment for hypothyroid. And generally it comes in a tablet form, and we generally assess the accurate dosage to start with. Then there is anti-thyroid drugs which are given to the hyperthyroid patients. They are methimazole, carimazole, propylthyroid uracil. Especially in pregnant women, we give propylthyroid uracil, and especially they help in the hormone replacement, and they are actually anti-thyroid medications in hyperthyroid to calm down the thyroid gland. Next is radioactive iodine therapy. Yeah, this is one of the major things which we generally involve a patient to get radioactive iodine done, especially in females with hyperthyroid. There we can't give the medicines because they can be teratogenic. So radioactive iodine before getting pregnant is a very good option. And they actually intensively ablate the overactive thyroid cells, offering an effective therapeutic approach. However, it necessitates the ongoing monitoring because after that you have to check the hypothyroid can occur because iatrogenic hypothyroidism can occur. So we have to supplement with euthyroid tablets also in some cases. Next is surgery. Yeah, when there is a fluctuating hormone levels in the blood test, it's a part of entire thyroid gland. We have to surgically excise or the full gland according to the scan. There are Hurther cells, there are lymphocytic cells or malignant cells. According to the scan, Chiraz score we do. Accordingly, we will check and change and excise the gland if necessary. Dietary lifestyle modification already addressed. There are supplements, there are iodine, selenium in hypothyroid patients. In immunomodulatory diets, like we have many, but I will sum up like gluten-free diets. They are very important in Hashimoto thyroiditis. We have to give to mitigate the autoimmune-driven inflammation. Then there is complementary alternate therapies also, like holistic approaches. They can have herbal adjuncts, which help in calcium, imbalances can happen, hair fall, ferritin is low, then we give some iron adjuncts, supplements, plus lifestyle changes, yoga. So these things are very important and critical. Also, monitoring is important, which we generally miss. So regular endocrinological visits are important, and that will help. The intensive and adaptive interventions will ensure the treatment to be taken regularly. Some personalized therapeutic approaches also we follow. In individual cases, we tailor according to the body needs. Sometimes the patient is obese, sometimes very lean, and having other complications. So we have to tailor and optimize the dosage so that the treatment which is given is optimum for the patient, for the thyroid health. So these things are important and are taken care of. So anything you want me to add on? Do you have anything while you are taking care of a thyroid health patient?
Yeah, I think you have covered a lot of points with respect to diet as well. and you have navigated us through all the the details. We have really explored about this condition, thyroid condition, and we have got good information. Yeah. Do we have any questions? I think since we covered the generally asked questions, we are good with the information you have given. Yeah. So thank you, Dr. Sumedha. It was, we had a good thyroidastic time, if I can say. We have really dived into this intricate world of little powerhouse. And so as we wrap up, here's to thyroid that dances to the rhythm of good health. Thank you again, Dr. Sumedha. So coming back to this thyroid disorders. So thyroid disorders, if left unaddressed, can have far-reaching consequences affecting not only an individual health, but also workplace efficiency. Today, we have tried to join the dots between health and productivity and try to shed light on why it is critical to evaluate and monitor thyroid health in the corporate landscape. More importantly, understanding the right symptoms, accurate diagnosis, and effective treatment can be transformative, not just for an individual well-being, but for the health and resilience of your entire company. As we wrap up this thyroid expedition, let's remember our thyroids may be small, but the impact is mighty. Whether they are partying too hard or taking a leisurely nap, these little glands, deserve some attention. So here's your thyroid to-do list. So first is pamper it with the right meds, feed it the good stuff, like how Dr. Sumedha has informed us. And, then we can see how this thyroid is working. And let me also add here, Assurance by NanoHealth has successfully managed and reversed this disorder, and we have pledged to continue to do this good work. Please reach out to Assurance by NanoHealth to ensure your and your team's health. After all, you cannot pour from an empty cup. Remember, a happy thyroid is a happy you. So until our next health rendezvous, stay thyroid terrific and keep those glands grooving. Thank you, everybody, for attending this session. Have a great day. Thank you, Dr. Sumedha.
Thank you, Arshia. Bye-bye.
Bye.